As we discuss the comparisons of tape, we're going to compare those tapes which have been the most usually used in athletics and clinical taping, and light elastic tape and KT tape. So as we compare these, first we're going to start with our regular athletic tape. So when you're comparing your tapes, you want to compare how friendly they are to the skin, as well as how they're going to work for us on our patient's body. So as a friendliness to the skin, this tape does not stretch very much. It has moderate breathability, and it doesn't stretch anything from its available length, which we can see. As we try our Leuco tape, which is a brown tape which we use quite a bit when we tape with McConnell techniques, and as we use the Leuco tape, it's the most rigid body taping tape on the market. So our Leuco tape stretches even less than athletic tape, and again, the athletic tape stretch is not visible, but we know when athletes have tape on for about 5 minutes after they become dynamic in weight bearing, that tape does stretch a little bit and allow a little bit of movement. When we tape with Leuco tape, we get much less movement, even with dynamic movement of our patient and weight bearing. So Leuco tape is a very rigid tape. It's extremely adhesive. It's what we call the human duct tape. So you want to be very careful if you get this adhesive on your patient's body at all. So it does not stretch much at all if we try to stretch it. The only stretch availability in this tape is the stretch that becomes available because the patient's skin will be mobile underneath it after they wear it for a period of time. If we try to turn this tape on a diagonal, it gets very quickly a wrinkle or a fold, and that will create a tape cut or a blister wherever that happens on your patient's skin. So that is not a wanted effect. With our cover roll, which is a white back tape with paper backing, and if we take the paper backing off of that, then we have a little bit of a cloth product with adhesive on the back. This tape is used most generally in a clinical setting as the skin protectant for your Leuco tape because this is so aggressively adhesive. So our patients need to have some protection on their skin. So that in the past has been a cover roll. The cover roll does not stretch very much, but it will stretch and get skinny in the middle. And when that happens, you have to be very careful when applying your Leuco tape so that you don't overlap the edges. But again, it does not turn very well on the bias, and it doesn't stretch much at all, just that little bit of stretch which makes it go skinny. So that particular tape is usually used in the past for a skin protectant. However, now that we have tape that are much, much more skin friendly, that's the type of tape that I choose to use with my patients, is a light elastic tape on the skin, so that I not only get the component of the light elastic tape that I want to work for my patient, but it's also skin protecting because it is so wonderfully nice to the skin as the patient wears it. As I look at my light elastic tape and my KT tape, I'm going to look at the quality of breathability of the tape. And the light elastic tapes, if you hold them up to the light, you can actually see through them. And that's because the waveform on the back does not have adhesive in those areas. Because there's no adhesive in those areas, it allows the skin to breathe, get rid of its sweat and toxins that you're giving off throughout the day, and then allows the skin to breathe, and it does not get irritated. That's why patients can use this for 3, 4, 5, 7 days and not be irritated when they remove the tape. When we try to stretch the tape stretches about 40% beyond its original length. So if this was the original length of the tape in a relaxed position, it stretches an additional 40%, which allows it to be used for multiple patient problems. If we stretch the tape a good deal, it can be used for connective and fibrous tissues such as tendinitises, joint capsules, ligamentous problems. If we don't stretch it at all, we can use it for edema. And if we stretch it just that 10% that the paper is on, it becomes a muscle technique. So when we're talking about the 40% available stretch in the tape, you have to really be aware that each amount of stretch in that tape is used for a different clinical effect. When we look at the tape, will it turn on a diagonal? It turns very nicely and doesn't create that wrinkle or fold, so that it will go around my patient's body contours as my patient goes through their range of motion and moves their joint through space. That allows me to get the movement patterns that I would like without compensation and without tension and rigidity of the tape limiting my patient in their patient treatment.